5:05. Good afternoon. Welcome to Mannin Line today. The second of our Ramsey MHKs this week on Mannin Line. Lawrie Hooper, MHK, Minister of the Department of Health and Social Care. So if you want to chat to Mr. Hooper about anything, anything in his portfolio concerning Ramsey perhaps as well, then by all means get in touch. Call 66 13 68, text 166 177, email studio@manxradio.com, and WhatsApp on the same number, 166 177, but you will have to put us in your friends. And contacts it is. Lawrie Hooper, Mr. Hooper, good afternoon. Welcome.
Good afternoon.
Lawrie Hooper became a Ramsey Town Commissioner in 2012. Is that right?
That is right, yeah.
Okay. How important do you think it is, or is it important, to have a grounding in local regional politics before Keys?
I think it really helps. It definitely helped me. I've said that before, and I'll probably keep saying it. I think it gives you some of an understanding of how government works, and I think you see that with some people who get into the Keys who haven't had some of that background. I think they're surprised sometimes at the way government does or doesn't do things that you'd expect.
And obviously, as leader of Liberal Vannin, I remember last year you came in with Paul Wetherall to talk about Liberal Vannin. As by and large there isn't a party political system in the Isle of Man, how do you square being leader of Liberal Vannin with Comyn?
It's an interesting one. I've got a kind of a tiered approach to these things. So ultimately, my conscience comes first. So anything that I don't believe in, I'm certainly not going to support if it's a matter of principle. Your constituency comes second, and then your party comes third. Comyn, I think, has to just lump it with the rest of them, quite frankly. So generally the way that it works at the moment is it gives us as a party a voice around the table. So we are in government essentially. So you have to think of it in terms of it being a kind of sort of coalition arrangement like you'd have in the UK or other jurisdictions. So far it hasn't come into conflict in too many areas. If I'm honest, mostly I think Comyn are broadly doing what I want them to do. So I think we're heading in the right direction with most of it.
A note in now. This is a text in from 488. Can you ask Mr. Hooper if we here in the Isle of Man are following the UK in not allowing healthy under 50s having the COVID jab? Manx Care's gone quiet on this. What's the situation?
The situation on the island is the same as it's always been, in that our vaccine programme mirrors the UK's. The public health advice is the same. So ultimately, we're covered by the same schemes. So we roll out the same kind of vaccine approach as the UK does. That's the way we've been doing it to date. At any rate, I'm not aware there are any plans to change that.
Okay, here's a question in from this is Phyllis. Phyllis, who just says, could you just separate once and for all, what's the difference between the Department of Health and Social Care and Manx Care?
So Manx Care are the people on the ground. They're the ones running the health service. So they run the hospitals, they contract the GPs, they contract the dentists, they run the social care homes that we have. They actually physically run all the facilities. So they're the ones that employ all the doctors and all the nurses. What we do as a department is with our responsibility is to set the overarching strategy and policy to make sure there is funding, and also then to provide oversight of all of that. So when Manx Care are saying, well, we're going to deliver X number of procedures, or we're going to have a waiting list of Y, it's our job to set those parameters, put Manx Care in that box, and then make sure that they actually do the things they are supposed to be doing. So we are sort of the oversight, the regulator, the auditor, and the policy setter. That's kind of our job in the department, and then it's up to Manx Care to go away and actually go and deliver on that.
At what point do you engage with them on any granular level or any detail level?
Very regularly, actually. So there's a lot of two-way communication, because whilst I think in a perfect world you have a very clear, distinct separation between strategy, policy and operations, I think the reality on the ground is that is never that straightforward. And so there's always an overlap, I think, between what is delivered on the ground and how that's delivered, and then where the department should be stepping in and saying, actually, this is the policy we need you to follow, this is the strategic approach, the thing we're trying to achieve. So there's a lot of overlap, which does require a lot of close working. And in fairness, there is some tension there, because the department often wants Manx Care to do things perhaps quicker or slightly differently to the way Manx Care thinks they need to be doing it. And so there is a grey area in the middle where I think there's always that kind of tension and that negotiation around, well, who is it that's responsible for this? And sometimes sometimes it will absolutely be Manx Care, and sometimes it will be the department, and sometimes it's a little bit of both.
Do you have regular meetings with Manx Care, or are they just as and when?
Oh no, they're very regular. I meet with various members of Manx Care staff, it's multiple times a week really, is how often there's that engagement. Much of it is informal. We also have quite a formal governance and oversight structure to oversee the kind of quality and safety, and then the mandate performance. So in terms of metrics, our Manx Care hitting the targets we're setting them to hit. So that's a much more formal, much more rigorous process, and that is, again, that's monthly, that is very regularly scheduled, and there's lots of informal contact in between as well.
What happens if they don't hit targets?
Generally, it's a multi-stage approach. If they don't hit the targets, or I think I'd probably say if they're not making sufficient progress, because the targets that we've set are quite ambitious in some areas, and I think we know that the health service was starting from a very low baseline, and so I certainly don't expect them to get to these targets within 12 months, within 18 months, within 2 years. Some of these will take much longer. Where they're not making sufficient progress, that's where we as a department will drill down to find out what the problem is, what's stopping them from achieving these goals, what is it we can do to help, is it something we need to do in the department to make changes, is it something we need to push Manx Care to change, to focus on, and ultimately we do have the power to direct Manx Care to do things. So if they are absolutely failing in their duty to deliver, the department does have that reserve power that we can legally instruct them to do certain things. Now, we haven't had to do that in the last year and a half. I think that would be a big escalation actually from where we're at the moment, but we do have that in the back pocket if it becomes absolutely necessary.
Could you ever envisage a time when Manx Care will be sailing its own ship, when all the targets have been hit and the Department of Health and Social Care will take a back seat?
I think I can envisage a time where things are much better than they are now, where those targets are being more regularly hit, absolutely. Whether that allows the department to take a back seat or not, I don't think so. I think it's like with any system of audit and oversight. When it is working, you don't see it working and you think you don't need it. The moment you stop doing it is when things then tend to start drifting and start going wrong. So I think at the moment we're in that stage where we're trying to get everyone to that level, and then I think the system will then, it'll be responsible for holding it at that level rather than allowing it to slip and get worse. But I think the reality is as well with healthcare, things are always changing, and so it's always going to be new services, new targets, new things we need to do. So I don't think it's ever going to be a finished product, if that makes sense.
Okay, so let's go to Julian now. Hi Julian, you're live with Lawrie Hooper, MHK.
Hi Andy, and hello Lawrie.
Hi Julian.
Quick one about masks. Andy, you may remember a couple of years ago, we had quite a long chat about a meta-analysis from a Dr. Kai Kislinski in Dusseldorf, who basically said that masks made no difference and actually had a lot of harmful effects, including the N95 masks, in things like they weren't able to filter the tiny particles, 4 times the safe CO2 levels within the mask, 14 kinds of fungus and bacteria that were leading to massive increases in acne, hypercapnia, bacterial lung infections, and also disruption in children, leading to delay in speech learning, social and health. Many children saying they felt joyless when they were forced to wear masks. And just the other day, the Cochrane Review has just come out and said that following a study of 280,000 people, they've come to the conclusion that masks make no difference whatsoever statistically at all. If anything, they made it worse, although they didn't go into the same level of detail as the Kai Kislinski one that we talked about a couple of years ago. I'm also concerned that Professor Susan Mickey, who was the lead behavioural psychologist at SAGE, who was on the television a lot saying we had to wear masks, has now moved to be a senior at the WHO, who are now trying to do a treaty that will force all member countries to abide by their diktats if they feel that there might even be a pandemic, even if there isn't actually one, but they think there might be one. So what I want to ask you, Lawrie, is following these 2 big analyses, and the Cochrane Review is a huge one, and it involves many top universities, including the University of Oxford, Queensland University in Australia, University of Ghent in Belgium, and numerous others. Will you be able to give some sort of guarantee that following these revelations, we will never have mask mandates on the island again?
I know the studies you're referring to, actually, and I was reading through an analysis of that Cochrane review quite recently, and the summary of that analysis, I'll read it out to you. Actually, it's a gentleman on Twitter has published this. It's quite interesting. The summary says, if you go to the primary studies, so actually look at the individual studies that the Cochrane analysis is doing a meta-study of, none of them support the conclusion that the meta-analysis states. And ultimately, that's the point. I think so. There is a lot of misinformation out there about masks, but the public health position, the advice, the actual studies support the position that they do work. They are effective. I can't really comment much more than that. I'm not a specialist myself, other than to say the evidence is pretty overwhelming in terms of what it says. And so if you've got access to that Cochrane review, I would encourage you to go and read through all of the studies that it is doing that meta or summary analysis of, and read the conclusions of each of those individual studies, because actually sometimes that provides you with a much more accurate picture. I'm not entirely sure how you've managed to, or rather how that study manages to conclude what it does based on the primary underlying information from the actual individual studies that were done, but it does make for some interesting reading. And so, no, from my perspective, I think we will always take the position of following clinical or public health advice on these matters. Really, it shouldn't be a political or politicised issue. If the science says it works, we should follow the science. That's what it really boils down to.
Well, I'm looking at page 2 of that report that you've just mentioned, and it says, wearing masks in the community probably makes little or no difference to the outcome of laboratory-confirmed influenza SARS-CoV-2 compared to not wearing masks, with a certainty rate of 95%. Harms were rarely measured and poorly reported, with a very low certainty evidence. So basically what they're saying is little or no difference to the outcome. So that's what it's saying on page 2. And for anybody that's listening, if you look at Cochrane, physical interventions to interrupt or reduce the spread of respiratory viruses. So I don't know, that says something to me that is, if they're saying little to no difference, then look, I mean, let's put it this way. If it turns out that it is true, are we going to get a refund from the UK government that basically told everyone to get these things at a cost of, what was it, 100 million?
I can assure you the Isle of Man has not spent anywhere near £100 million on masks. I have no idea where you got that figure from. I would love to have £100 million spare in the healthcare budget to fund anything, quite frankly. But again, all I can say is read the primary studies underneath. These meta-analysis quite often are high level. They aren't necessarily reflective of what is actually out there. So, like I say, I'm not really in a position to challenge the scientific consensus on this. The general consensus is they work. Whether you like that or not is almost beside the point. But from an Isle of Man perspective, we are out the other side, really, of the worst of the COVID pandemic. We are definitely still seeing long-term consequences, I think, of COVID. We're seeing that across the piece in education effects, in healthcare effects. I don't think that's ever really going to go away. It'll take us a long time to recover from that. And so whether or not, if this comes back, if something similar comes back, if we're in a similar position again, we will do, I think, what is the right thing to do, which is to turn back to the professionals, the people that spend their lives working on these things, and take advice from them.
Right, having said that, there used to be a consensus that the Earth was at the centre of the universe with many scientists, but I think they were proved wrong in the end. Well, one quick question for you. If it turns out that this drag queen thing that happened at QE2 actually happened, will you be looking into this from the perspective of children's mental health if they're being sent out from classrooms because they are saying, no, I don't believe there are 73 genders, only 2? Do you think there may be some mental health issues there that might actually be worth you pursuing?
So as far as I understand it, that's being investigated by the Department of Education to establish the facts. I'm not really in a position to comment on speculation and social media comments, so I'm going to have to wait for the outcome of that investigation to see what really happened. But ultimately, I think the broader position is if there is something for the health service to pick up as a result, we'll have to. But as I said, I'm not really in a position to comment on that.
Okay, all right, Julian, thanks for calling today. We appreciate it. A note in from Keith for Lawrie Hooper. Ramsey Town Commissioners have increased the permit price for camping at the Murrock from £30 to £100 for this season. Huge increase without any reason given as to why. Do you think this huge increase is fair, considering the cost of living crisis affecting people on a low income that use the facility?
That's a really interesting question. I don't think I've got a view, if I'm honest. I don't know enough about the background as to why the price would have gone up that much. It does feel like a large increase from what you're saying. Actually, that does feel like it is a big jump. I would normally advocate increase in prices to be inflationary where possible, but ultimately I think the cost of providing a service needs to be met as far as possible from the people that are using it. So I can understand maybe if there is something that needs to happen, maybe there's some investment going on that needs to be funded. Your best bet would be to speak to the commissioners about it. I believe, and I'm not sure I'm giving away any state secrets here, that one of our local commissioners will be on the Mannin line next week.
Ewan McGuinness, lead finance commissioner.
I would encourage you to ask Ewan actually that, because it's a good question to ask, and it is definitely something that I think you'll be able to answer.
Okay, this is Pete in Peel who just says, has the department agreed a suitable pay rise for medical staff?
So this comes back to the question about the difference between Manx Care and the department again. So Manx Care employs all of our medical staff. The vast majority of there are a handful of advisors that work for the department. So really the negotiations on pay are between Manx Care and as the employer, and then the staff side, obviously as the workers. So as far as I know, those negotiations are still ongoing. They are in some respects dependent on what happens in the UK, because we are linked in many ways for some of our pay scales to UK conversations as well. So I'm not aware that's been finalised yet, but really it will be up to the department to support Manx Care in whatever settlement they reach in making sure that can be provided for and funded in some way.
Okay, well, luckily, Teresa Cope's on Mannin Line. Next Wednesday, Teresa Cope will be on with the two leads of the Wellbeing Partnerships in the West and the North. So we can ask then. Jane's with us. Hi, Jane, you're live with Lawrie Hooper.
Hello, good afternoon. I'd just like to give some feedback, if I may, about a recent hospital experience that I had. We hear lots of reports, and I know there was a report not long ago, which was not the best report about A&E. What happened to me was I was at the Southern 100 dinner, slipped on the dance floor and ended up dislocating my fake hip. So I was admitted to A&E, and I have to say that every single member of staff in every department, the service was immaculate. It was a Saturday night. They were busy. Even though they were busy, they were attentive. Everything was done so efficiently. And when I was anaesthetised the following day, the hip was put back in, and I managed to get home after seeing the physio in the afternoon. So really it was just to say, thank you to all of the staff on Ward 11, and they're doing a wonderful job from my experience.
Well, that's really good to hear. I mean, it is always good, I think, to give positive feedback. Quite often, especially with social media, you tend to just get the negativity coming out. So it is really nice to hear you had a good experience down there. If you haven't spoken to the staff already, I'd strongly suggest you do. I mean, I think they would be happy to accept any sorts of baked goods as well, is my general experience of hospital staff. But
well,
it's really good.
My husband has actually written to thank them, so yeah, all of them. So it was just to give you some positive feedback for a change.
Brilliant. Thanks very much.
Okay, thanks, Jane. Good to hear from you. Thanks for that. A note in, this is Texter 892. We've been on the dental list for 7 years. My two daughters are 10 and 7. They've never seen a dentist in 10 years, only they need to see one now as soon as possible. But they've tried many times to resolve this with no dental offer. What's the process of getting children onto the dental list?
So that feels like it's a very long time. I know the waiting lists are long, but 7 years feels like far too long, actually, from my experience. My first port of call would be to give MCALS a call, the Manx Care Advice and Liaison Service, on 642 and actually explain to them the situation. They should be able to help in terms of making sure that you're on the right list, and that if there is anything that needs to be done more immediately, they should be able to point you in the right direction.
Okay, Texter 488 says now, the UK average GP practice is 9,000 patients. Ramsey Group Practice has got 18,000. Dr. Allinson was on yesterday. Of course, he has no equity in Ramsey Group Practice anymore, although I think he does act as a locum occasionally. Dr. Allinson said the group practice can cope with a further 2 housing estates being proposed, and the government's got a plan to grow the population without increasing infrastructure. Do you think Ramsey needs another GP practice?
That's a really good question, actually. Whether or not we need another practice or whether we just need more resources in our existing practice, I suppose, are the same question. I would think the answer to those is probably yes. and not just in Ramsey. Actually, we've seen down in Ballasalla, you've seen one of the practices now hand their contract back. We know that there are GPs across other parts of the island who are also under similar pressures. It's not a Ramsey specific issue. But yes, this is definitely something that needs to be looked at, and there's a massive piece of work going on inside the healthcare transformation program, which we call Primary Care at Scale, which is basically designed to understand a bit more about how primary care is working and should be working, and then how we get from where we are now to where we need to be. Some of it will be recruitment, so it will be bringing in, if we can, more GPs. Some of it will be staffing practices with a broader variety of experienced staff. So I know Ramsey, for example, has a paramedic on staff now, and he can do some of the stuff that maybe the GPs used to do, but it doesn't need a GP to do. There's also work going on to try and figure out whether we can push demand elsewhere. So are there some people seeing a GP who perhaps could simply go to the pharmacy and buy something over the counter? And before anyone says it, I know we have similar issues with pharmacies in Ramsey. That is another thing that I'm working on. But in principle, at least, that's the way the system should work, is if we can make sure people are going to the right place to get the right care, it takes pressure off other parts of the system where maybe they don't need to be there, so someone else can then utilise that facility. So it is a really good question, and I think the short answer is yes, we do need more resourcing in our primary care service. The longer answer is how you do that, where the money comes from, where the resource comes from, and ultimately where the staff come from. And when you start talking about staff, they are going to need somewhere to live. And ultimately, this is the key problem that we have, is we do need to grow our population because we need to bring in more medical staff. We need to bring in more teachers and more builders and more e-gamers and everything. But they need somewhere to live. And so we need to build houses so they can come and live in them. And so it is a little bit of a catch-22 in terms of, do you build the houses first before you have the people, or do you have the people before you build the houses? I think in the real world, you can't have people without the houses. So you kind of have to build them first. But it is absolutely about getting the infrastructure right rather than trying to grow the population in the face of not doing that. So
okay, that brings me on to the Vollen and the proposed development. There is a public consultation next Tuesday, the 7th, from 4 till 8 at the Ramsey Town Hall. This proposed residential development by Hartford Homes, including community facilities, the possible future school at the Vollen. Mr. Hooper, what do you think to this?
So I have to be very careful not to comment on planning applications, because if it does need to come to the Council of Ministers for whatever reason, I don't want to end up having conflicted myself by having expressed a previous view on whether or not it's good or bad or indifferent or otherwise. So all I would really say is what I've already said, is broadly across the island, I think we do need more housing to make sure that there are houses for our residents to buy, to rent, to live in, and also houses then for the people that we know are going to be coming over to fill some of our vacancies. Where those houses go, where the individual developments or not are appropriate, is not something I'm able to comment on because of my role. But I think in broad terms, I think I do sit on the Housing and Communities Board for government as well, and so I think I am quite pleased to see there are developments coming forward across the island to try and meet that unmet housing need. A
message in from Colin. What's going on at Lloyd's Pharmacy?
That is the multi-million-dollar question, I think. So for a long time, I've been very keen to see us have an extra pharmacy in Ramsey, an independent pharmacy, something that isn't Lloyd's, because I do think we need that local competition to try and up standards. There's been a lot of work going on with Manx Care and Lloyd's behind the scenes to try and stabilise the ship, to try and improve the situation. There are a lot of challenges. Part of the challenge is the simple nature of the fact that they're a private firm, and so they operate essentially under contract. It's a bit more complex than that, but the reality is that they don't work for Manx Care, they don't work for us as the department, so they are an independent business, and so there's only so much you can do to influence their staffing practices, their rotas, their everything they do in terms of supply. There's only so far you can go to influence that.
But you must have had feedback. I mean, people are getting it in the neck, aren't they?
Oh, absolutely. It must be really difficult actually being a staff member in Lloyd's at the moment, because they're kind of caught between a rock and a hard place.
And let's just say, well, there's nothing against the staff. They're working all the time. They've been put in an invidious position.
Yeah, and I think that's a fair comment. I think they're stuck between patients who are struggling to access much needed medication and a system that sits behind them that perhaps isn't being as supportive as it needs to be. And it certainly isn't working very well in terms of getting those supplies through. There is a lot of work going on. I'm hoping there'll be some positive announcements in the very near future. I don't really have a timescale, but I'm hoping weeks or months rather than years, if I'm honest. But I can't really say much more because of all the stuff that's going on behind the scenes, but I would like to try and reassure people that this is very high on the priority list.
Okay, hi Juan, you're live with Lawrie Hooper.
Hey Andy, how are you, Lawrie?
Hi there, hi Juan.
Hi mate. 2 points. I'm just picking up on something. This not the first bit. It's not what I came on about. But you're picking up there on accommodation that you need for medical staff, etc. And I heard this being put out quite some months ago about that. And I made the point a few months ago on this program. I just finished a development in Central Douglas, which I thought was very suitable for nurses in the sharing capacity. And I actually contacted the department asking them about if they wanted that property, and they said they'd find it very hard to fill that because the nurses wanted accommodation around the hospital, and this is Central Douglas on a bus route. So I just want to put that out there that, you know, I phoned up and offered it on the advertising that you asked for, and I didn't seem to get any positive feedback. Now, the main point that I came on about was you were talking about following the science before. And when we look at where the science originates from, likes of John Hopkins, Harvard, Imperial College, all these other places, and then we look at the sponsorship that these here places get, tends to be a little bit tainted sometimes of like where they're getting the information from, when the people that sponsor it are people like the Gates Foundation who have vested interests in pharmaceutical industry. Now, the point I'm coming to here is a lot of people in government seem to be, and also mainstream media, seem to be what they call repeaters. So you repeat information rather than study in any depth. And I'm going on to a bill that's just been passed, RS 30190 in Idaho, USA, which has gone through, been put through by Senator Roberts, asking for their government to have an in-depth study on the efficacy and safety of mRNA vaccines. This is being brought about by the elephant in the room all around the world at the moment, including England, of myocarditis, blood clots, bleeding after post-vaccination on birth and menstruation, and a substantial lack of birth rates around the world, including Switzerland at 9%, Germany at 12%. I could go on a lot more, but my question is to you, and you've said that you're not an expert on this, you just follow the science. Is there any thinking outside the box from the Isle of Man government, going back to what's happened in Idaho now, on the efficacy of the vaccines that you have been promoting on the Isle of Man for people to take?
So to get these things out in the first place, there is a lot of work and research that goes on. It's a heavily regulated sector, so we're relying on those people who spend their lives doing this, regulating not just vaccines but all sorts of medication. There is quite a robust system in place to do that. That's why these things quite often take years to get out from under the rug. And that's really the system and process you rely on. Either you trust the process and say, yes, we're confident that drugs generally are produced in a safe way, or we're not. And if you're not, don't take paracetamol, ibuprofen, or anything else that's gone through exactly the same process. And that's the reality here. I'm not an expert in this. You're not an expert in this. There's no point me doing months of research into it, because I will never be able to do the decades of research that these specialists and professionals have done into this. It would be a full-time job for me. It would be a massive career shift, and ultimately I wouldn't be able to do something that I think I am doing reasonably well. So on balance, I can't see the value in trying to replicate things that already exist. So in terms of these systems, what I would say, and I think it is absolutely fair to say, is that you're not wrong in terms of vaccines do have side effects. Every drug has side effects. And if people have had side effects, or they think they've had side effects from the vaccines, there is a system in place called the Yellow Card Scheme, which you can report those, which means that feedback goes straight back into the system in terms of people like the MHRA who do these reviews, which will then inform the work that they do on the efficacy of vaccines, and that's the work that we ultimately rely on. So in some ways, it is better to be part of these much larger systems, these population level systems, because as an island, we are very small, and in in terms of the resource that will be required to do this ourselves. I don't think we have that. I don't think we have the specialism or the expertise to do that ourselves. And equally, I don't know what validity it would have with such a small population. So I would encourage people, if they do have concerns, they do think they've had effects of vaccines, to make sure they report it through the MHRA yellow card system, which you can find on Google. It's quite easily accessible, because that's the best way for the government over here to make sure we can make the right decisions, as you make sure the right information goes into the right people who have the skills and the expertise to assess it in the right way, and then they can make recommendations as to what should or shouldn't happen.
Okay, that's the MRHA yellow card system.
Yeah.
Okay, just a brief final word, Juan.
Yeah, I mean, there was a meeting a couple of weeks ago with Hugo van Voorden. I think I've got that right. And one of the vaccine injury group on the Isle of Man, I believe. And he mentioned something about some kind of study or investigation that could possibly take place. But we have a group of people on the island who are reaching out to use, asking for help on this situation. And I'm just wondering, are you looking at that? I mean, you said before about wasting time on looking into it and the depth of that, and I appreciate that. But there was an 11-2 majority vote on this going through at Idaho. They feel that it is necessary to take this further or give it to some scientific body to study it further. That's all I'm saying is the government here thinking outside the box? Because I've not heard anyone mention anything in government about this whatsoever.
So again, the US has a similar system to what we use in terms of that independent regulatory process. So I would expect that it's already gone through the FDA process in the US in order to get validated in the first place. So a bill asking for someone to go and basically do that whole thing again, to my perspective, without knowing more about it, feels more like a stunt than anything that's going to achieve anything. With the greatest of respects to my legislative colleagues over there in Idaho, I don't know enough about why they're doing it or what they're trying to achieve. If we did something similar and said, let's refer it to an expert medical body to make an expert medical decision on whether or not this vaccine is suitable, that's what the MHRA already do and already have done and do constantly through these review processes. And so that's why I mentioned that yellow card scheme, because that's the way they gather data in terms of what is happening out there in the real world after these things are being delivered. So I'm not sure what it would achieve if we try to get another body to try and do the same piece of work that's already constantly kind of ongoing anyway.
Okay, all right, Joan, thanks for that. We've got people lining up, so I've got to move on now with Lawrie Hooper, MHK, the Minister at the Department of Health and Social Care. I just want to give a big up to Ramsey, by the way. Ramsey Town Band took third place in the finals of the National Brass Band Championship of Great Britain. They were in Blackpool, impressed the judges with their rendition of Hungerford Town. So well done to the Ramsey Town Brass Band, Robert Quain's musical director, and well done to Manx Concert Brass, participated, and they came third as well. So well done to Ramsey Town Band. Juan McGuinness, Lead Commissioner on Finance and General Purposes, on Monday on Mannin Line.
Welcome to the fish market at Robinson's, where Master Smoker Angelo is always busy in our traditional smokehouse, creating the most delicious smoked seafood from the freshest sustainably caught stock. So delicious, we won multiple Great Taste Awards. Follow our Facebook page for all the latest news and offers. The Fish Market at Robinson's, Cool Road, Braddon, a proper fishmonger where nothing is too much trouble.
Get your garden ready for spring with Riley's. Seed potatoes to garden machinery. Get down to Cool Road, Braddon for everything you need. And all your pet supplies and birdseed too. Leap into spring with Riley's Garden Centre.
Whatever your assets, you want to ensure that they're protected and passed on to the right people in the way you want them to be. Simcox Advocates provide effective solutions when dealing with wills, trusts, powers of attorney, property and foundations. Simcox Private Client Team has a reputation for excellence, rated top tier by independent law directory, the Legal 500. Simcox Advocates, advising businesses and families since 1949. Visit simcox.com.
Heard the goss? Some very famous people have been getting cosy at Millie Chaps of Ramsey. Guess who they are? And you could win an incredible bed worth £500. Call in at Parliament Street and see if you can identify the celebs in a bed. Text their names and your name to 166 177, starting your message with the word bed. All correct entries will go into the big prize draw, live on Manx Radio at the end of the month. And check out Millie Chap's extensive bed range at the island's only Temper Collection studio. Celebs in a Bed with Millie Chaps of Ramsey and your nation station, Manx Radio.
This week we've been celebrating World Book Day 2023 with Holmes & Davison Opticians by releasing a bedtime story each day. As the week draws to a close, we'll be releasing a special Manx language version of tonight's classic bedtime story alongside the original.
Run, run as fast as you can. You can't catch me, I'm the gingerbread man.
Rai, rai, Otavia's other who had Genu, miss your tartan, miss your fair, and ginger.
So join me, Kim Quine, over on the Bedtime Story podcast every day this week for a brand new bedtime story with Holmes & Davison Opticians and your nation station, Manx Radio.
The Mannin Line with Andy Wint.
And Lawrie Hooper, MHK, Minister of the Department of Health and Social Care. On Tony, you're live with Lawrie Hooper.
Hi, how you doing, Andy? How you doing, Lawrie?
Hi there.
I've got two questions, in fact. One, did you realise, Mr. Hooper, that Ramsey has 5 licences for pharmacies and all are owned by Lloyds? Therefore, it's a monopoly. That's the first question.
It's not strictly the case. So there's no such thing as a pharmacy license. What happens is you get added onto what's called the pharmaceutical list, and they weren't all issued to Lloyds. So my understanding is some of them are still owned by the firm that's called G.J. Maley's, so it's still theirs. But Lloyds obviously acquired all of the firms that had these licenses, and so you're absolutely right. It is a monopoly provision in Ramsey. The pharmaceutical list only has Lloyds chemists on it at present, which is something I'm trying to get changed through the process we're going through with Manx Care to get someone else onto the list, essentially to give them a license who isn't Lloyd's Pharmacy, because I don't think it should be a monopoly. I don't know why that was ever allowed to happen in the first place. It isn't something I would have supported at the time, and I don't think monopolies in general terms are healthy things, and especially when you're looking at something like this that's a critical service. I don't think you can be entirely reliant on one provider.
Well, I agree 100%. So my question is, have the rules within Manx Care, and are they going to be changed so that this can never happen again?
Yes, so that's part of the work that's going on. So we're looking to change the pharmaceutical regulations to make it clearer about how licences essentially are granted, but also about the transfer and sale thereof, because one thing I am nervous about is if we were to grant somebody else a licence today, add them to the list today.
Yeah, then Lloyds could buy them.
Exactly, and so that's something we're working on to make sure that it would need, in simple terms, I think the department should have to approve any transfers of licence or transfers of responsibility, because there needs to be some kind of check and balance that asks the question, is this the right thing for the island? And if it is, absolutely it's fine, it's a marketplace, these things happen, but if it's not the right thing for the island, just like the Competition Authority in the UK can step in and say, you're not having that merger, you're not doing this, we need the same ability on the island, I think.
Yeah, I think the issue is a rule that says if you want to, or you take some company over that's got a licence, then you need to sell that licence to somebody else who is not part of your company.
Yeah, there are multiple ways I think you could achieve it, but I think the core point is it absolutely needs to be in place, because I don't think it's just Ramsey that will have this issue. I think there's a risk that it could happen elsewhere in the island as well. We're seeing it happen in Ramsey, and that's why I think it's quite visceral for us, because we're seeing it every day and we know what the consequences are.
My question then is, when is it going to be changed, and when are we going to see a different pharmacy available in Ramsey?
So we have run, we collectively, Manx Care and the department have run a process to ask for people who are interested in acquiring a licence, getting added to the list. That process has gone through. My understanding is we're in a period now where they are looking to actually issue something, and that's why I talked earlier about some of this. Hopefully there'll be some news on this within the next either few weeks or couple of months, really, because we have to work with whoever it was that essentially gets the licence to make sure it's all handled in the right way, because what I don't want to do is have a big splash about things that are happening if then there are other potential delays or things behind the scenes. So it just needs to be handled in the right way, but I'm trying to reassure you that it is absolutely a priority. Things are moving quite quickly, and we should see some positive news very soon. It's just a case of making sure it's done in the right way.
Fantastic. It's good to know that something's being done. It would be really useful if instead of this being behind closed doors and kept to one side, and I don't expect you to publish everything, but we should have some sort of issuance of notices of what we are working on, instead of finding out simply by actually asking questions on Mannin line.
Yeah, so we have published a lot of this already in our department plans or the island plans, so a lot of this is out there, but I completely appreciate it's not exactly front and centre, and I think when there is so much going on, it is quite difficult to draw people's attention to stuff that is quite key, because whilst this issue is really important to you and me, because it affects us a lot, it might not be quite as important to other people who want other things front and centre. So you're right, we need to get better at how we communicate this, and I absolutely agree.
I'm sure if the commissioners were brought into it, they'd let everybody know.
Okay. All right, thanks, Tony.
Take care.
All right, good to hear from you. Thanks for being with us today. Just a note in, Grovemount Dental Practice has offered to take on more patients, but the DOH won't give contracts to other dentists in the practice. Is that right?
So there is a report actually that's just been published by the Social Affairs Policy Review Committee into dentistry, and front page news, I think, the other week. But in essence, there are a certain number of dental UDAs. So the way that the dental service is paid for is it's basically they get paid for doing a job, and there's a certain amount of money allocated to that. That money translates into a certain amount of UDAs, and those UDAs are all contracted out to dentists. So in short,
so industry jargon, UDA,
units of dental activity. Right. Essentially, having your teeth cleaned might be 1 point. Having your teeth out might be 3 points, that kind of thing. But essentially, the budget is fully allocated, as I understand it, to existing contracts. So the question that's being asked is, can we make the budget bigger to have more contracts out there? The answer is, well, of course we can, but we have to take the money from somewhere else. And so that's the difficult balancing act we have in the healthcare system at the moment. Is I would very much like to increase the dental budget because I think it is very much needed. The question then is, what budget do you reduce in order to fund that? Or do you, in fact, have to fund it through other means by increasing charges somewhere else inside the system? And those are conversations which I think we need to start having with the public about saying, well, actually, if you want better services, we are going to have to find a way of paying it. Does that mean we have to talk about taxation? Does that mean we have to talk about some kind of charging system? Things like dentistry, it's relatively simple for because actually we already charge for a lot of that, but it is already unaffordable for a lot of people, and that's the other balancing side of things is you can't just put the price up and expect it to solve all of your problems. So it's a really complex question, but I think the question is absolutely right to be asked is how can we increase the dental budget and the number of units of activity that are out there, and then how can we make sure they are actually getting delivered as well for patients, because I think you're right, I've talked to a number of practices who would be quite happy to take on more work, they'd be quite happy to do more NHS dentistry, but the question is how are we going to fund that?
Okay, back with Lawrie Hooper, Minister at the Department of Health and Social Care in a moment.
TGI Fridays, Harry Ramsden's, Greg's, Chiquito. They're each loved for food and enjoyment. And now they've all teamed up with Iceland to bring their famous food direct to you. Piccolino, Yo, and many more. All in one place. Shop right in Douglas. So anytime you're craving for what makes them famous, we can help. No defrost, no prep, no waste. Straight from the freezer into the oven. And all at great prices. New exclusive brands, only at ShopRite Douglas. Selected products in other stores.
You're in the car and you've been circling the car park for what feels like forever. No spaces in sight and the queues are backing up behind you. Then, out of the corner of your eye, you spot someone with shopping walking towards you. They gesture that their car is right next to you and the only space is now yours. Woohoo! This is how it feels when you save over £500 versus MT with our broadband, home, phone and mobile bundle. Start saving at shaw.com. T's and C's apply.
When you need a fitting memorial or headstone for a loved one, contact Manx Memorials in Peel. This long-standing family-run Manx company offer a wide range of granite and marble headstones and memorials, along with an island-wide inscription and renovation service. Manx Memorial's skilled professionals will take the time to help you choose a suitable memorial, and we're proud to say we'll beat other local quotes. Call 843-861 or email matthew@manxmemorials.co.uk.
Got a nice motor to sell? Come and see us.
We are number one. We are family run. Mike's Motors. Mike's Motors.
At Mike's Motors, we don't just sell nice motors, we buy them too. So if you have a nice camper van, motorhome, car, van or commercial vehicle, we'd love to take a look at it. And if we like it, we'll make you a nice offer. Get in touch. Visit mikesmotors.im or call 823 200.
Mike's Motors.
That's 823 200.
After 2 weeks on the road, FC Isle of Man return home in the NWCFL Premier Division this weekend, hoping to keep up their recent turnaround in form. The Ravens welcome Winsford United to the Bowl on Saturday night, with the Manx side aiming to make it 3 wins from their last 4 games. Join me, Rob Pritchard and Tony Mepham for FC Isle of Man versus Winsford United this Saturday, kicking off at 6 p.m. Manx Radio will be providing full live match commentary on our AM 1368 and digital platforms. Live coverage of FC Isle of Man on Manx Radio is supported by Selton, investing in our community.
The Mannin Line with Andy Wint.
Faster Mike, good afternoon. We're live with Lawrie Hooper today. And Louise, you're live with the Department of Health and Social Care Minister.
Hi, Mr. Hooper.
Hi, Louise.
It's just a question for you, really. In the UK, from the 1st of April beginning next month, women who are prescribed HRT are now going to be able to access a prepay certificate scheme, which they will only have to pay a one-off charge, which will cover all of their treatment for the year. And it's going to be, in the UK, £18.70, which they say is the cost of 2 single prescription charges. I know ours are less on the island. But my question to you is that something that will be introduced on the island?
So I don't know enough about the specifics to give you an answer, but what I can say is we are looking at prescription charges more broadly at the moment. So there'll be news coming out on that hopefully quite soon.
Because at the moment, for prescriptions, you can buy a one-off certificate. Is it £58 for the year?
Exactly. So it may very well be.
And to be fair, that is quite, that is half the price as it is in the UK. Yeah. And to be honest, I mean, I've used that myself, but that's really good price if you need other medication, because it will cover you for everything. But this is something that women do not have any say in. This is something we have to take. We don't have to take, but we only have to take because we're female. And I mean, there's so many studies now of saying that how people can really suffer with menopause symptoms, which affect so many aspects in your life. I mean, just speaking from a personal point of view, I have been reasonably lucky when I read sort of some of the problems that some people have. The worst I had was 6 months of chronic insomnia. You try surviving on 1 to 2 hours sleep a night and see how perky you feel at the end of that. It got to the point where I couldn't even drive because I didn't even trust my judgment. And once I started taking HRT, it actually cleared that up in a week. It's not perfect, but I can function now. And that is a very, very common symptom of menopause, apart from anything else, which there are far worse things than that. And I just think something that we have no choice in having to take, doesn't affect everybody, of course it doesn't. Some people need to, some people don't. But a lot of people have no choice in taking that. And by pure biology, we have to fund this. And I just think if it could be looked at, to help women access it, it could prevent so many problems in the future.
Yeah, I mean, I would agree with you that, to be fair, any medical condition isn't a choice. If you've got diabetes or whatever it may be, you've not made a conscious choice to go and do that. So I think the argument you're making is absolutely valid, and it applies across the board, really, that says, look, if you do need whatever it may be on prescription, should you be able to find a way of buying it, like the prepayment certificates, to say, and it should be covered by that certificate. My view is it should, actually. There are lots of medical exemptions that don't make a lot of sense, but actually the income exemption is one that really does make sense, because if you're low income and you can't afford that £5 a month for the prepayment certificate, well, actually maybe we should be helping people in that respect, and maybe other things should be covered by the certificate that currently aren't. And this is all the work that we're looking at the moment.
But this is starting in the UK in April. How much do you say it is, Louise? £18?
Yeah, they're saying it's the cost of two items, which I know is it's definitely less over here at the moment.
And is it something that the department would look at?
Like I say, it's not something that I've come across myself yet, but I'll happily take it away and have a look into it as part of the work. I don't have any objections to doing that at all.
Good. Well, we've opened the dialogue. Louise, thanks for calling today. I really appreciate that. With Lawrie Hooper, MHK, one of the Ramsey MHKs, and I got a message in from I don't know. This is Graham, who emailed this from Bryden, said, I have watched Mr. Hooper's career intently over the past 10 or more years. And he tells me in 2011, in the general election, you came 5th out of 6 with 310 votes. In 2016, you came 2nd with 1,471. And you topped the poll in 2021 with 1,657. He just says, what does Mr. Hooper think he's doing right with the electorate?
That's a really good question.
Did you know that?
Obviously, I'm aware. I've got to look at the numbers in front of me. I'm glad someone is keeping count. Thank you very much for that. Generally, my approach from day one has simply been to just try and be honest with people and just do the job that I'm elected to do, and that can be difficult sometimes because I have had some quite robust conversations with constituents when they're not happy with decisions I've made or things I've supported. But ultimately, it's my job to do the best thing, I think, for everybody. And really, I think when I ran in 2021, the approach I took was to say, look, this is the things I said I was going to do. These are the things I did. This is what I'd like to do. You see what you get, basically, and take it as it comes. And if you don't like my approach, if you don't like the things I'm trying to do, please vote for somebody else, because I'm not the kind of person who's going to kind of give way and change my views just because someone is shouting loudly at me. And I've just felt generally just be straight with people, and people are straight with you. And
you mentioned tax earlier on. Would you be happy to put tax up on the Isle of Man for a better Manx care system?
Personally, I would, and I actually talked to a lot of constituents about this when I was out canvassing, and I think a lot of people had a very similar view, which was we'd be collectively, I think, happy to pay a bit more, provided we knew it was being ring-fenced for something like healthcare. I don't think a general price rise is what people were getting at. It's not something I really talked about, but I did very specifically talk about things like free personal care in terms of nursing and residential care, like they have in Scotland. That would cost money, but ultimately I think it's the right thing to do, because the current system we have is really unfair for a lot of reasons that I don't have time to get into.
All right. Very briefly, do you think the rich should pay more?
Yeah, proportionate systems of taxation are something that I'm very much behind. You'll have seen in the budget this year, Dr. Alex Allinson brought forward a proposal to taper off the personal allowance at the top end of the income scale. That's something I first suggested to Treasury in 2016 after my election. I've been writing to Treasury every year saying you should do this because proportionate taxation is much more fair than flat rates that we currently have. So I'm very much in favour of people paying a fair share.
Okay, thanks for being with us today. We appreciate
very
it.
Much.
Good to talk to you. Lawrie Hooper, MHK, with us today. And more Ramsey on Monday. Joan McGuinness, lead Ramsey Commissioner on Finance and General Purposes. Next Wednesday, Teresa Cope will be on Mannin Line with Claire Bader from the Western Wellbeing Partnership and Gary Lord from the Northern Wellbeing Partnership. And that's it for this week. Thanks to Paul Moran on the phones. Enjoy the rest of your Friday and have a great weekend.
W-I